I always enjoyed the digital workflow, and one advantage I found was the sort of efficiency of workflow, less number of visits for both the patient and the practitioner. This sort of involves sort of not always the practitioner having to go ahead and scan the patient's mouth in. Sometimes the nursing staff could also get involved in this. The scanner that we use in practice is an Itera Element Flex scanner. Very basic type of scanner, but it's been a steep learning curve and has worked its wonders with recent updates with software and everything. We decided to use Dentuvo with ALS Labs because we found them quite efficient with their workflow. They came into practice, showed us how to use their procedures, how to scan in, and that this has reduced our workflow from say 4 or 5 visits for patients, almost down to 1 or 2 visits for all our patients, reducing NHS waiting times and all staff embracing the digital workflow. The journey we found with ALS and the support we've had has been absolutely excellent. They've held our hands all the way throughout. They've come into the practice, shown us how their workflow works, and they've pretty much sort of dictated to all the staff how the whole thing should go. And that's made the journey so much easier for all dentists, clinicians, and also nursing staff. The efficiencies that we've seen in the practice so far, one, it's reduced the working times with patients coming in for less visits. It's reduced our NHS waiting times as well. Instead of having 4 to 5 visits for patients as well as clinicians, it's reduced it down to 2 visits. In some certain cases, it's not the clinician taking the impression or scan. Now, nursing staff can go ahead and take a digital scan, and sometimes patients are just coming in for a denture fit in 2 weeks' time. The feedback we've received both from patients as well as staff, we've found that patients are a lot more happier, the dentures are fitting much better compared to the conventional route. Sometimes with the conventional analog route, we'll be taking impression, the impression can distort. They prefer to have a digital scan compared to a conventional impression. This has improved the workflow and patients being a lot happier with their final result of dentures. Along with that, the patient can now see, whilst they're having a scan done, what their mouth looks like and what sort of end product they're going to get from all of that. Sometimes it's helped to treat and plan the case a lot easier for the patient, involving the nursing staff as a treatment coordinator as well. The biggest benefits using Dentuvo as a dentist is the digital workflow. They can communicate with you immediately. For example, I've got some dentists taking a scan. They'll get the patient to wait to see if the lab's happy with the scan. So that reduces the number of visits for the patient to come back to have additional scans done, along with reducing the number of visits that we have with the patients. That's also improved the number of appointments that patients are having to have. The biggest benefits to our patients with Dentuvo is that they're not having to have an impression, they're having a digital scan done. They can see the scan being done and they can see the condition of their mouth. And the number of visits that they're having to come back for is reduced from 4 to 5 visits right down to 2. In practice, if we've had to go ahead and repair a denture, the biggest advantage we've found is that we've not had to go ahead and take an additional scan or impression. The digital scan is sitting with the laboratory. They can download the scan and they can print out a new denture immediately, reducing the number of visits the patient's having to come in for. When patients are having a scan done, we normally offer them, along with an NHS denture, if they want to have an additional denture. This has improved our business quite a lot for both dentists and the practice, because sometimes they can have 2, 3 dentures printed, one for work, one for at home, and this has improved not have repeated impressions as well. Now that I've embraced the digital workflow, going back to the original way of doing impressions would be very difficult and challenging for us. We find that our consumables cost has reduced hugely. We're not having to order impression materials as much. We're taking a digital scan. Most of the time the clinician's not having to go ahead and take a digital scan. It's sometimes the nursing staff that go ahead and do it. So it's embraced the team a lot more and working as a whole team.